Hi, my name is Kinley Sanders, and I will be presenting to you today the research and history of lobotomies. Introduction. What is a lobotomy? A lobotomy is a surgical procedure where the tissue of the frontal lobe is severed in order to cure mental illness in patients. When did lobotomies come to fruition? The non-reversible transorbital lobotomy was created in 1935 when two American scientists heard of its benefits when conducting it on aggressive chimpanzees. Who were involved in the early studies? Carlisle Jacobson and John Fulton realized that the surgical damage done to the chimpanzee's frontal lobes were useful. Antonio Egas Moniz was an astute researcher and had been nominated for very prestigious awards. And when Jacobson and Fulton presented their study to Moniz, he thought that it would work very well with his seriously disturbed and agitated psychotic patients. The prime. What came next? Going into 1936, Moniz had reportedly conducted a style of lobotomy called leucotomy, where he put two holes in the skull right in front of the temples, where he began tearing through the cerebral tissue. He performed this surgery on at least 20 patients who had had a range of mental disorders spanning from OCD to bipolar disorder. The behaviors of his patients afterwards would be described as lethargic, apathetic, and very passive. Moniz only suggested using this surgery as a last resort category, only if every other treatment option had failed. Who are Walter Freeman and James Watt? Walter Freeman and James Watt were American neurologists and believed that the lobotomy would be a major success in the treatment of psychiatric disorders. They began by renaming the leucotomy to lobotomy and used a medical instrument shaped like an ice pick shoved into the patient's eye socket and into the brain. This technique showed to be a lot quicker than the way Moniz conducted his surgery and allowed for easier access to the brain. What were the results? The transorbital lobotomy caused an explosion within Freeman, and he began conducting these surgeries on over 3,000 patients. The sadistic nature of Freeman caused Watt to drop out of the study because Watt was the trained surgeon and Freeman was not. Throughout Freeman's expedition of his surgeries, about 2.5% of his patient surgeries ended in death. Pictured below on the bottom left-hand side is pictured Walter Freeman and a patient where he is using the lobotomy technique. It is noted in research that nobody wore masks, there was no gloves, and that the sterilization of the instruments were not that good. Onto the right-hand side is pictured where the ice pick would be inserted into the front cerebral cortex of the brain and allow for the lobotomy to take place. The end of the lobotomy. What happened? After the split of Walt and Freeman, Freeman began traveling around the world in an RV which he named the Lobotomobile. He began showing how this could be done at home with very minimal effort. By 1951, the surgery had been demonstrated on over 18,000 patients. What came next? What came next after years of medical disagreement with this procedure was after the surgery had been done on not only agitated psychiatric patients, it became a solution for disobedient behavior in individuals as well. In the mid-1950s, lobotomies went out of the medical practice and replaced by the antipsychotic drug Thorazine, which was labeled basically a chemical lobotomy. Further research. The lobotomy was never thought of as a cure for psychiatric disorder, but more of a symptom reducer. Among the first patients who were operated on, they were originally diagnosed with schizophrenia, but the procedure at times were performed for stomach ulcers and ulcerative colitis as well. In conclusion, lobotomies were an act of pure ignorance and even sadistic in nature. The lobotomy was proven time and time again to not be medically accurate or achievable. With the new safety measures involved and no backing research, the fall of lobotomies couldn't come soon enough. The most famous lobotomy was performed on Rosemary Kennedy, which failed and resulted in her not being able to walk or talk for the remainder of her life. She received her lobotomy when she was 23 and lived until she was 91. Pictured below on the bottom left-hand side of the screen is Rosemary Kennedy, pre-lobotomy and post-lobotomy. On the bottom right-hand side are a number of articles where they had no research authorization and that allowed for them to not conduct research properly because none of them were submitted. The number of codes that were submitted in the middle were the successful ones, and down at the bottom are the codes for the ones that were kind of left behind. I am Kinley Sanders, and I thank you for listening to my presentation. Here are my citations. Thank you.